I thought this documentary was incredibly interesting. I feel like the first initial thoughts I had after and during watching it was just disgust truly with the John Hopkins staff and how it was handled. But after stepping back a little bit and taking the past few days to really just look at it from a wider concept of being a healthcare professional in that situation, I have been able to kind of shift my opinion somewhat. I think that it's interesting and important to look at the hospital staff and put myself into their shoes. And something that I've really taken through learning about the code of ethics and everything is our commitment to non-maleficence and beneficence. We are taught time after time to do no harm and to do what is best for our patients, even if we think that that might not be the best thing in our own opinions. Doing what is best for our patients' physical and mental health is so important and ingrained in us as nursing students that I almost understand why the John Hopkins staff did what they did. And I think that looking at it from an outside perspective and through watching the documentary, it's easy to see why I was so mad initially at the John Hopkins staff. And I still don't believe fully that they did everything right, because they absolutely didn't. But we are taught to listen to our gut as nurses and how important it is to do no harm to our patients. And I think in this situation, when these red flags were going off to these healthcare professionals, she's been to so many different doctors. The mother is immediately coming in and demanding this, and this, and these insane doses of ketamine. And it just seems like very alarming things to the staff at the hospital. I think that that would set red flags off in my head initially as a nurse. I really do. And I think that listening to our gut is important, because while this may not have been a situation of abuse, there are situations of abuse out there. And knowing the red flags of those situations is so important. I think that while that being said, what's almost just as important is understanding that Beata was watching her child, her young daughter, deteriorate in front of her every single day, hour after hour, minute after minute. She's getting worse. She's in so much pain. And she, as a mother, I can't imagine how painful that would be for Beata and her father to have to sit there and watch that and feel so out of control, especially being that Beata was a nurse, and just feeling completely out of control in the situation. They've been to doctor after doctor, and nothing's helping her. And then finally they find a doctor that thinks that he can help her. I think that any parent immediately would say, yes, please do anything you can to help my child, because watching Maya go through that and just constantly getting worse must have been so painful for the entire family. So I think that even if these ketamine treatments seemed so outlandish, at that point they would do anything to help their daughter. And that's why I think that as healthcare professionals, we have to be able to look at the overall picture of this family. And while Beata may not be the most outwardly sweet and kind and easygoing mother, she is constantly let down by these healthcare professionals who can't help her daughter. And she thinks that she knows now what it does help. So of course she's going to be very direct and demanding, because she's a mother. Like, everyone always refers to like the mama bear, and that's what she was. She was trying to help her daughter, and she clearly loved her daughter. I don't think that anyone was questioning that ever. But I remember there was a part in the film where someone said you can love and also do harm at the same time. But I think that the way John Hopkins went about it was just done so poorly. I think that if there was that suspicion, there should have been a psychological exam done on Beata sooner. And once it was proven that the Munchausen's by proxy was out of the picture, and that she was only suffering the adjustment disorder and the depressive disorder from being separated from her child, that it should have been reevaluated. And I think that there should have been a lot more open communication between the doctors at Johns Hopkins and the family instead of just fighting each other. Because really, at the end of the day, both sides care about Maya. Both sides want Maya to get better. But it's just the lack of communication, the lack of education, and that just kind of blew up in both sides' face, because without those communication skills and that understanding from both parties, you're never going to get anywhere. And it truly does break my heart that Maya had to suffer through all of this, and that the mother ended up taking her own life as she did because she really thought that was the only solution to the situation, when in reality that's never the solution to anything. I just overall think that by stepping back and looking at the situation as the view of a healthcare provider, I do understand more now why Johns Hopkins staff did what they did and the reasons why they acted as they acted in the beginning. But I think that overall it's so important as nurses to uphold those ethical principles of non-maleficence and beneficence, because those are so crucially important as nurses and just healthcare providers in general. But also to understand this family's pain. Yes, you're trying to uphold these values, but at the end of the day, you have to take nothing personal as a nurse and understand the pain of these families who are going through these treacherous treatments and cannot seem to find any kind of relief, and be more understanding and open to different things so that there can be better communication between both parties.